Hello and welcome back to Cancer Council ACT's Let's Chat LGBTQIA+ and Cancer podcast. Last episode, we started looking at the risk factors for people who identify as part of the LGBTQIA+ communities. Harry from Meridian, Canberra is back with me, and today we're going to continue on with some of those risk factors which might get overlooked. So Harry, what can we learn from the research?
Yeah, so the research tells us that folk from our communities have overall higher rates of consumption of alcohol, higher rates of smoking, higher rates of use of other drugs. And that's not because of the letters of the acronym we might be. Around alcohol, for example, a lot of alcohol companies sponsor a lot of events that our communities hold. On the other side, just because there are those high rates, there are also individuals in our community who don't drink alcohol at all and who don't smoke at all. So don't assume somebody's alcohol consumption or smoking based on, they're a member of our communities or not. And again, building that trust and showing that respect so that the person is able to share with you their lives and how they might be consuming alcohol or other drugs or what their smoking might look like or maybe they're a non-smoker, like I said. So just because the research tells us something doesn't mean we need to assume that about the whole population and populations of our communities. But yes, it's important to be aware of it. It's also important to know the human being sitting in front of you, what's their risk profile, what's their individual risk profile.
Perfectly put, because from a health perspective, there are also a few risk factors we as health professionals need to be aware of that I just wanted to touch on that maybe haven't been considered. So lower rates of pregnancy in the LGBTQIA+ communities is one example. So research shows that pregnancy before the age of 30 and using oral contraceptives may offer some protection from breast cancer and other gynecological cancers. We also see higher prevalence of individuals living with HIV, which makes people more likely to develop some cancers, things like Kaposi sarcoma, aggressive B-cell non-Hodgkin's lymphoma, and cervical cancer. Now, I think it's really important to note that 25% of the population with HIV is heterosexual, so it is something to be aware of with all patients that we see. And finally, we do see higher rates of HPV, which causes many different types of cancer. So make sure that your patients know about the vaccine and have had it, especially if they move to Australia after the age of 12 or 13, because it's part of the school immunisation programs. Now, Harry, I guess looking at take-home messages for our audience listening, any main points that you'd want a health practitioner to take home regarding risk factors?
Yeah, I think it's to really focus on what's the risk factors of the individual sitting in front of you. So having built that respect, having built that trust with the person, then you're going to be more able to build a reliable picture of what their individual risk factors are. And then you know that you're going to be offering the correct screenings to that individual rather than what the research might say to focus on, because there's outliers in every community. And also to realise that something mightn't be just done in one hit. A person might need a support person. They might not. A person might need more support and more information before they decide, yes, I agree that I need this screening. So just being open to it, just not being how you might necessarily ordinarily do something, but understand that people might be more hesitant, they might have more questions, and they just want to know that they're not going to endure more harm in doing this, and then they can do it in a way that's safe for them, in a way that works for them.
Yeah, and I just wanted to add to that. I think a lot of people would probably be aware of the stereotypes and feel like that's what's going to come out in an appointment, and making sure that that's not the reason you're asking a question is, I think, just a way you can build that trust too. Harry, Thank you for your incredible insights today. We are very privileged to have you here sharing all of this with us. So thank you, thank you. You'll be back joining me for our next episode where we're going to get a little more practical and talk about some tips on how health professionals can make their practice more inclusive. Very much looking forward to that one. Thank you so much, Harry.
Oh, thank you. Thank you, Ash.
And thank you to everyone listening, and bye for now.